Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Good afternoon, ladies and gentlemen. His Excellencies, the Secretary of the Directorate General of Health Workers, Mr. Sugianto, MPH, World Health Organization Representative to Indonesia, Professor Roderick Salenga, MPH, the Directorate of Yogyakarta Health Polytechnic, Dr. Iswanto, SPD, MKes, respected lecturers and faculty members of Yogyakarta Health Polytechnic, and all of the distinguished guests that have attended today's lecture. My name is Tiara Shifa Hernoa, and I am honored to be your Master of Ceremony. Firstly, please allow me to read today's agenda. Number 1, opening. Number 2, a welcoming speech by the Director of Yogyakarta Health Polytechnic, Dr. Iswanto, SPD, MKes. 3, an opening speech by Mr. Sugianto as the Secretary of the Directorate General of Health Workers. 4th, a guest lecture with the theme Health Leadership in a Changing Health Landscape by Professor Roderick Salenga, MPH. 5th, a signing of Report of Visitation by Professor Salenga and Dr. Iswanto. 6th, photo session for documentation. 7th, closing. Coming up next is a welcoming speech by Dr. Iswanto to open today's lecture. Let us welcome Dr. Iswanto.
Thank you very much. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, salam Om Swastiastu, Namo Buddhaya, salam kebajikan. The Honorable Pak Sugianto, Sekretaris Direktorat Jenderal Tenaga Kesehatan, and Prof. Eric from WHO, Indonesia, WHO, yeah, thank you, and also Bu Sri from Ditjen, and all lecturers and Poltekkes Yogyakarta, students, and also the participants both in this room or also and online daring. I'm profoundly honored to welcome the representative of World Health Organization Indonesia to our little exclave of an auditorium for a lecture titled Health Leadership and a Changing Health Landscape. I'm pleased to take the opportunity to introduce our guest for this afternoon. He is none other than Prof. Roderick Salenga. He is WHO Indonesia acting team leader for health system strengthening. Thank you and welcome to Health Polytechnic Yogyakarta. Ladies and gentlemen, my beloved students, the theme of this lecture is very much relevant to all of us. Change and innovation in health happen at rapid pace, but we have to consider them as a challenge instead of a burden, a need for an adaptation instead of prideful ignorance. So I hope all participants, both from Polkesio or other health polytechnics, can listen to the lecture, ask some question, and have an insightful discussion, because this topic will be greatly important for your professional life. Ladies and gentlemen, I wish this lectures enlightens us all and provides us with approaches to deal with the problem of tomorrow. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Iswanto, for the warm welcome. Up next, an opening speech by Mr. Sugianto, MPH. Mr. Sugianto.
Assalamualaikum warahmatullahi wabarakatuh. Sorry, Eric, I would like to speak in Bahasa because the message should be received through exactly. Yang kami hormati Pak Iswanto selaku Direktur Poltekkes Kemenkes Yogyakarta, Honorable Eric Selenga from WHO Representative Office Indonesia, and also all of participants, both online and offline, and also Ibu Sri Wayuni. Tentunya pertama saya ingin mengucapkan selamat menjalankan ibadah puasa di bulan Ramadan ini. Mudah-mudahan kita bisa mengikuti semua aktivitas ini menjadi bagian dari ibadah di bulan Ramadan. Kemudian tentunya sekali lagi saya mengucapkan terima kasih kepada seluruh partisipan, baik yang hadir di daring maupun luring. Saya dapat laporan dari Bu Sri ada sekitar 400-an yang sudah join di 500-an dari seluruh Poltekkes seluruh Indonesia, yang ini menjadi sebuah kesempatan karena kita akan mendapatkan semacam dosen tamu dari WHO, perwakilan Indonesia. Jadi Bapak Ibu yang kami hormati, jadi di dunia ini secara global ini kan WHO, tetapi dibagi berdasarkan regional, dan di Indonesia ini masuk dalam regional SEARO, Southeast Asia Regional Organization, artinya bagian dari WHO yang ada di gabungan antara Asia Tenggara dan juga ada Asia Selatan, di mana Indonesia salah satunya adalah anggotanya. Kuliah tamu dari katakanlah Pak Erik ini menjadi salah satu bagian agenda dari kerjasama kita dari Kementerian Kesehatan, khususnya Direktorat Jenderal Tenaga Kesehatan dengan WHO. Jadi salah satunya adalah bagaimana WHO ini memberikan katakanlah support kepada politeknik kesehatan, khususnya pada 4 Poltekkes sebagai pilot project untuk program penguatan kelas internasional jurusan keperawatan. Jadi nanti kita di Indonesia, khususnya di 4 Poltekkes ini ada kerjasama untuk bagaimana pelaksanaan kelas internasional yang ada, terutama jurusan keperawatan itu betul-betul berjalan seperti juga kelas internasional pada umumnya, bukan kelas internasional yang sifatnya hanya rintisan, yang hanya istilahnya sebagian saja menggunakan bahasa Inggrisnya. Nah, jadi sekali lagi seluruh sivitas akademika yang ada di Poltekkes Yogyakarta patut bangga karena Poltekkes Yogyakarta menjadi salah satu pilot project untuk program ini. Jadi tepuk tangan untuk Poltekkes Yogyakarta. Nah, jadi sekali lagi ini tentunya diawali dari jurusan keperawatan. Kedepan sangat mungkin kalau sekiranya nanti memungkinkan bisa jadi untuk program studi yang lainnya. Tetapi ini karena kenapa kita mengambil jurusan keperawatan? Karena ada kaitannya dengan nanti lulusan dari jurusan keperawatan ini agar bisa diserap untuk bekerja di luar negeri. Nah, dalam kesempatan yang baik ini saya ingin mengetahui yang ada di sini yang dari jurusan keperawatan mana ya? Sebelah mana? Coba angkat tangan, angkat tangan, angkat tangan. Ya, oke. Saya tanya, apakah di antara yang hadir di auditorium ini ada yang berminat untuk bekerja di luar negeri ketika setelah lulus? Angkat tangan yang paling tinggi. Coba, jangan turun dulu. Coba. 1, 2, 3, 4, sebelah kanan 4, 5, 6, 7, 8, 9, 10, 11. Ya, jadi hanya 11 dari, termasuk 12. 12 dari berapa Pak Is? 400. 400-an ya. Jadi ya kira-kira 1/40, 2,5%, nggak sampai 5% Pak. Jadi kurang dari 5%. Jadi saya berharap lebih meningkat lagi nih nanti, ya Pak Is ya. Jadi ini kesempatan karena saat ini kita banyak sekali menjalin kerjasama untuk terutama dari jurusan keperawatan ketika sudah lulus itu bisa bekerja di luar negeri, tentunya dengan berbagai macam persyaratan sesuai dengan negara yang dituju. Kembali kepada terkait dengan katakanlah dosen tamu yang dalam hal ini akan menyampaikan materinya. Ini adalah bagaimana meningkatkan atau mengkondisikan ekosistem atau iklim atau chemistry untuk kelas internasional itu harus terpola. Jadi bagaimana mungkin kita kelas internasional tidak ada dosen tamu yang memang sudah level internasional. Jadi sekali lagi manfaatkan momentum ini baik yang ada di daring maupun luring. Jadi sekali lagi kami juga memberikan semacam semangat kepada adik-adik yang dari poltekkes lain yang mengikuti secara daring untuk tetap semangat aja, karena sangat mungkin suatu saat ada juga dosen tamu yang lainnya juga yang mungkin nanti bisa melakukan kegiatan seperti ini di poltekkes yang berbeda. Mungkin di poltekkes yang sekarang adik-adik yang daring ini ke depan sangat mungkin nanti luring. Jadi sekali lagi tetap semangat aja, terutama kepada adik-adik mahasiswa yang di luar Poltekkes Yogyakarta yang sekarang mengikuti secara daring. Untuk yang Poltekkes Yogyakarta yang mengikuti secara luring, tentunya ini sekali lagi mohon dimanfaatkan kesempatan baik ini. Nah, kenapa muncul katakanlah kelas internasional? Ini tentunya tidak lepas dari transformasi Poltekkes itu sendiri. Sekali lagi, sekarang Poltekkes kondisi yang sekarang berbeda dengan Poltekkes sebelumnya. Forum-forum yang sifatnya mendukung untuk pengembangan kompetensi ataupun kapasitas ini tentunya akan lebih didorong lebih banyak lagi kegiatan-kegiatan seperti ini. Oleh karena itu, adik-adik mahasiswa yang kuliah di Poltekkes baik di Yogyakarta ataupun yang ada yang mengikuti secara daring di seluruh Indonesia harus bangga kuliah di Poltekkes Kemenkes. Tepuk tangan untuk Poltekkes Kemenkes. Karena betul-betul kita bagaimana mengkondisikan Poltekkes ke depan betul-betul sudah melakukan transformasi yang tentunya untuk mendukung kemajuan Poltekkes baik secara kualitas ataupun serapan lulusan untuk bekerja di luar negeri. Tentunya juga ini memberikan motivasi kepada Bapak Ibu dosen yang ada, yang hadir, yang di auditorium ini yang secara luring, dan juga Bapak Ibu yang dosen yang hadir secara daring. Jadi tentunya nanti Bapak Ibu dosen untuk lebih termotivasi lagi bagaimana meningkatkan kapasitas dan kompetensinya, terutama terkait dengan kemampuan bahasa Inggris. Saya yakin dan percaya di Poltekkes Kemenkes Yogyakarta dan juga yang lainnya di seluruh Indonesia sudah memiliki, tetapi saya lebih mendorong lagi untuk lebih meningkatkan lagi. Karena di era global yang seperti sekarang ini, tidak menutup kemungkinan talent-talent yang ada, baik ini dari mahasiswa ataupun nanti lulusan ataupun dosen, itu bisa mengikuti forum-forum internasional lainnya. Dan ini kita terus mendukung bagaimana agar forum-forum internasional ini bisa juga diikuti oleh dosen-dosen Poltekkes Yogyakarta dan juga Poltekkes lainnya di seluruh Indonesia. Karena kesempatan ini tentunya tidak mudah, oleh karena itu persiapkanlah secara kapasitas, persiapkanlah secara katakanlah kompetensinya, agar betul-betul siap untuk berbicara di era global. Demikian yang dapat saya sampaikan. Sekali lagi selamat mengikuti kuliah tamu dari Mr. Eric from WHO Representative Office of Indonesia, and again I would like to thank so much to Mr. Eric for coming to Poltekkes Yogyakarta to give international lecture. Terima kasih. Saya akhiri, wassalamualaikum warahmatullahi wabarakatuh.
Thank you. Thank you, Mr. Sugianto, for the opening for today's event. Ladies and gentlemen, we have finished our opening session. Now, towards our main event, we will have a material presentation delivered by Professor Roderick Salenga on the topic Health Leadership in a Changing Health Landscape, which will be guided by Mrs. Niken Melani as our moderator. But first, please allow me to read you her CV. Mrs. Niken was born on the 30th of May in 1982 in Magelang, Central Java. She has a master's degree from the University of Diponegoro on health promotion in reproductive health and HIV/AIDS studies. She is currently attending the University of Gajah Mada for her doctorates and is currently a lecturer at the Midwifery Department of Yogyakarta Health Polytechnic. Without further ado, Mrs. Niken and Professor Salenga, please come forward.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Bapak Sugianto, the Honorable Ibu Sri, and then the Honorable Bapak Direktur Poltekkes Kemenkes Yogyakarta, and all of the audience. Good afternoon, everyone. Welcome today in guest lecture for all students and also lecture in topic health leadership and changing health landscape with the speaker, Mr. Prof. Roderick Salinga, World Health Organization representative to Indonesia. Thank you, Mr. Eric. I can call you Mr. Eric? Okay. Mr. Eric, welcome to Poltekkes Kemenkes Yogyakarta. And before this session start, maybe let me introduce the participants in front of us. There are the students also lecturer from Poltekkes Kemenkes Yogyakarta, and I will. There are 6 departments in Poltekkes Kemenkes Yogyakarta. Please raise your hand if I call every department. Okay? Okay. First, nursing. Hi, nursing. Okay, maybe you can okay or yes, okay? Or midwifery, beautiful, okay, it doesn't matter. Okay, I will repeat again. 1, nursing. It's fasting, I think. Okay, the second is midwifery. Why? The pink one. And then the third is dental health. Yo, okay. And then teknologi laboratorium medis. Kenapa hu ya? And then environmental health. Hi. And the last one is nutrition. Hi. Wow. 1,000 I think. So, okay. Ladies and gentlemen, before we begin, I'll introduce also to all of audience our speakers today. He is Mr. Prof. Roderick Salinga, or we can call Mr. Eric. He is a professor of public health pharmacy from University of Philippines, Manila, and where he held various leadership. For example, College Secretary, Deputy Director of Community Health and Development Program, and also Chairman of Pharmacy Department. He served at Philippine Pharmacists Association in various capacity. In 2014, Mr. Eric joined to the World Health Organization, and he also earned various awards and recognition such as 2015, the Outstanding Young Man of Philippines, also in 2018 as ASEAN Pharmaceutical Association Awards for Outstanding Pharmacists, and the last 2020, Prof. Eric can get Eric Nobla Excellent Award as the highest award conferred to a Filipino professional by the Professional Regulation Commission. So we can get a lot of awards for Mr. Eric. And ladies and gentlemen, now the speaker for Mr. Eric for maybe 30 minutes enough. And then after that we can open the question session for maybe 10 or 15 minutes. Okay. Okay, Mr. Prof. Eric Salinga, time is yours.
Okay, first of all, I'd like to say good afternoon to all of you. I apologize because I am not yet good in Bahasa Indonesia, but I'm attending classes every Wednesday so that I will be good in Bahasa Indonesia when I come back next time. Okay? All right. So, first of all, I'd like to say good afternoon again, Pases, Pa, Bushri, faculty and students, our moderator. I am very happy to be with all of you this afternoon. In fact, if not for a very short stay here, I would want to interact more closely with the students because as Ibu moderator mentioned, I am actually a faculty member as well in the past. So my life was with the university for a long time. So that's the reason why every time I come back to schools, I always feel energized. Because I think the energy from the youth is really contagious, isn't it, Ibu? So my topic for today is quite broad. And in fact, I would want to make it as probably concise as much as possible so we can have time for questions. And hopefully, you learn something from this lecture because when you look at the topic, and I'm grateful for the technical team for supporting the aspect of moving the slides for me. I'll talk about health leadership in a changing health landscape. In the next slide, I want to just share to all of you what I intend to cover for today. First, good thing, all of us are health professions related, all right? And so I think it's a common interest for all of us to look at health and health systems. And then we'll talk about health system challenges and what is health leadership, most especially in the context of Indonesia. Before coming to Indonesia, I was actually a technical officer in the other side, in Papua New Guinea, for 5.5 years. And when my time has come that I need to move because we have mobility in WHO, I got the opportunity to work for Indonesia, and I was very excited because I know that there's a lot of things going on in the country. In fact, you can actually claim that you are part of the center of the world because, number one, the dynamic population that you have, the economic growth that you're experiencing over the last few years, the regional leadership that you're showing. But then, of course, there are many things that we still need to tackle. So I'm very, very privileged to be working with and for Indonesia. That is something that I just want to share with all of you. And then the last part of my discussion with you, I'd like to talk about some practice advancement and our interest towards what we call integrated people-centered health services. Okay? So let's go for the first slide. I think every health student should know this, isn't it? What is the definition of health? Right? I'm sure that many of you have tried to memorize many definitions, but please, of all those definitions, don't forget the one that is embodied in the WHO Constitution, right? When WHO was born, member states all over the world said, this is how we want to define health. How was health defined? They said, it is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. All right? This definition says a lot of things. You see, it's not just biological, it's not just physical. It talks about mental, right? Mental health, social health, right? And so that's the reason why we appreciate health more broadly, because now, for example, when you see a patient with tuberculosis, you just don't say, that person is a TB patient. He is infected with Mycobacterium tuberculosis. End of story. No. Because when you look at this definition, you would say that this person is a TB case, infected with Mycobacterium, but he has a story to tell. Right? Because he's part of a broader society. And you know very well, for example, in tuberculosis, the physical environment plays a major role as well. And same thing for other diseases, which we will cover or probably cite in our discussions today. And then, what I wanted to highlight here is the concept of health, not just merely the absence of disease. Not because I am without tuberculosis, I can automatically claim that I am healthy, right? Because there are some components. For example, I just don't feel very well because emotionally, I am not healthy. Or socially, I'm not healthy. In fact, from a different perspective, some people would even consider economic health as a factor, right? How can we claim to be healthy if we're not able to buy what we need, for example, such as food and other basic commodities? So what am I trying to tell you, dear students and participants who are online with us? Basically, what I wanted to mention is that health is not a microscopic thing. Health is very broad. And if it is very broad, that means to say everyone in this room, online, and outside that world has a place in it. The question is, what roles do you play? What do nutritionists play? What do nurses play? What do environmental health scientists do or can contribute? That is a question that we want to answer today. And then, if you would also look at the definitions here, you would see how health is appreciated as a basic fundamental right. Nobody should be prevented from accessing health. It is your human right. It is inalienable, meaning to say it is part of your being, regardless of what you are, who you are, religion, race, political belief, economic or social condition. Health is supposed to be within your reach. And health, on the latter part of the slide, you can see the small definition there. I wanted to emphasize that health is not just at the individual level. Why are we so interested in health? Because it has community effect. What does that mean? When a person is healthy, the person is active. When the person is active, the person is productive. When the person is productive, he can contribute, not just for himself, but for the broader community. You talk about the family, the villages, the municipality, the district, the province, the nation. Healthy people is equal to healthy nation. Do you agree? Yes. So, in the next slide, I just wanted to show to you, in relation to what I have been discussing, if our colleagues can move to the next slide, health is actually determined by many things that we call as social determinants of health. No? The previous slide on social determinants of health, we can move to that. You could see that there are social, economic, cultural, and political conditions. Unfortunately, we only have 30 minutes to discuss this, so I won't be able to go this one by one. But what I wanted to tell you, I am a health professional myself. I'm a pharmacist by training. And then I have additional qualifications in public health and also in pharmacoepidemiology, right? But my perception now of health is really not entirely on biological basis. I now appreciate that I have a broader role to play because as I fulfill my roles as a health professional, I also fulfill my role as a social development agent. What does that mean? Together with your technical expertise, like a nutritionist, for example, as a midwife, for example, you bring with you something that can actually help the social economic development of your locality. Why? Again, because if you keep people healthy, they become active, they become productive, they contribute to your community. So I see my role as a health professional not just on health, but also on the social development space. You are agents of health and agents of change. Have you embraced that role yet? I hope you are finding that, no? That you are not just future health workers, you are future change agents as well. The next slide, I wanted to show to you how powerful you can be as health professionals or as professionals in general, no? In public health, I'm sure many of you have public health courses, so I'm sure that some of you have tackled this. You look at the diagram or the illustration here, you would see who are the people under your influence. Only one group, two groups, three groups? Answer is no, all groups, right? That's how powerful you are, because your scope of power and influence as health agents is from the healthy population down to the people who are already sick and recovering. And that reminds me of my public health background, which says we are in the business of preventing diseases, prolonging life, and promoting health. Right? Those are the three tenets of public health. And how do we do that? No? Maybe some of you are still thinking of your traditional roles, because in Philippines, where I come from, pharmacists have traditional pathways. There are three. Either you go to the drugstore, you go to hospital pharmacy, or you go to the industry for manufacturing. I did not do any of those three. I went beyond. I went to a different pathway. And that's the reason why probably my perception of my role as a health professional is quite broad. Not just focused on singular roles, but rather I appreciate my role on its impact to the community. All right? And how do we do these things? These are just suggestions. Maybe we do education, we do it through policy making, or we do it through research. The next slide, please. What is here? Okay, this is a product of an actual exercise. No? In my previous station, we were trying to put together a strategy for maternal and child health. Right? So we said we have to do something because the numbers, the indices, the statistics are not encouraging. So we have to do something. But for us to understand exactly how we can work, we have to first scan what is the situation. What really is the problem? And because of our awareness about the social determinants of health, when we ask the question, what is the problem? This is the problem. Right? What do you see in this picture? It's too complex. Because health is complex. Right? Health is complex. And because it's not just determined by biological agents, it's also determined by social, political, economic, cultural factors. So if you ask the question, why do babies die or why do mothers die when they give birth? The answer is here. Somewhere here, if we find the best strategy, then maybe we can solve it. But what am I trying to show you here? Our work in the health areas, is never simple. It's always complex. For some pessimistic people, they would say, oh, it's too complex. We don't want that. But for you, especially in your generation, you're supposed to be more adventurous. You would want challenges. You don't see this as challenges or difficulties. This complex mapping only shows to you there's a lot of opportunity. Find your place under the sun. Where do you want to make an impact? Right? The next slide, I want to show to you, again, a review of what the health system is. Are you part of the health system? Are you part of the health system? Yes. Every one of us is part of the health system. In fact, even if you're not a health professions education student, right? You being an individual, you are part of the health system. But what makes it doubly important for you to understand this, it's because you are a human resource for health. All right? In this visualization, I just want to remind you, from the WHO perspective, there are 6 building blocks of health system. Okay? Let's enumerate them. There is governance. There is health financing. You need money so that there will be services. You need medicines and health technologies, right? You need health information system or health information service delivery. And the last one, definitely not the least, you. Who are you? Health workforce, right? Health workforce. Please remember this. I've mentioned this in our meeting this morning. We can never talk about health without health workforce. There's nothing that we can do if there are no nurses, no nutritionists, no pharmacists, no sanitarians. there's nothing that we could do without the workforce. So, what I wanted to show here is that if the building blocks are working together very well, we will be able to produce the outcomes and the impact. And these are, for example, improved health, equitable health outcomes, and improved financial protection, which is more related to the social health insurance. But the idea is people will be protected. You will be covered, as they would say. The next slide will show to you the situation. Unfortunately, every day, day in, day out, the health system is constantly receiving lots of challenges and pressures from all directions. Again, going back to my original statement a while ago when I compared the pessimistic versus the optimistic, could these challenges really be just challenges, or can they be considered to be opportunities? And also, very importantly, if this is happening even in rich countries or in highly urbanized settings, for example, don't you think that these challenges are more pronounced in resource-limited settings? Yes, right? Because the resources are limited. So the next slide, I just wanted to show to you some quick reflections of what's happening globally, no? And you should be aware of this because you are the future. This is the future that you are coming into. And eventually, you will be the ones managing this situation. That's the reason why our topic for today is health leadership. No? Number one, there is a growing paradigm shift. No? Dear participants, no? What is the growing paradigm shift? The growing paradigm shift says, you know, if you want to talk about productivity of a country, don't just look on the economics. You have to reflect on the health of the people. So it's not just economy, it's now healthy country, healthy economy, healthy people. I'm not sure if you have encountered the concept from Bhutan, the concept of GNI, Gross National Happiness Index, gross national happiness instead of gross domestic product, right? Because it puts premium on the people. It puts premium on the development of the people rather than just looking at the economics of things, right? Then, what happened in 2020? Where were you in 2020? I was in Port Moresby in 2020. Where were you in 2020? What was the most important event in 2020? COVID-19. And I'm sure you can appreciate that many things have changed after COVID-19. Most of us are still wearing masks because we want to protect ourselves, right? Ways of working have changed. Now you have remote working, flexible working, no? Teleworking, no? And it had created opportunities for other industries. Like, for example, now, instead of going to the grocery, things can be ordered entirely online. Is it true for medicines, for example? Yes. Is it affecting the health landscape? Yes. And you know how serious that would be, because if that's not done properly, we are necessarily exposing our patients to unsafe products or even practices. So the COVID-19 increased the public demand for quality health, quality service provision, including more personalized care options. And because of all this, there is an increasing and changing societal expectation. We have to rethink what health is, no? And then, very importantly, I remember before, for us to do meetings, we have to be physically present to attend meetings, right? Now, you can attend the meeting from your kitchen. You cannot say, oh, I'm busy, I have something to do, I need to do this. But they say, oh, you can take the call from home. Now, in fact, for those of us who are working, we know very well that the traditional work hours have changed already. It's not anymore 7 to 4 or 8 to 5, right? Because even in the evening, we receive many calls or many messages because technology is a driver of change. How do we use it so that we will be in a better situation? That's something that you have to answer. And then the public health sector is now encouraged to have more perspectives rather than just have small group of experts. We want to hear from more people. In fact, in decision-making processes, we want to hear more from patients, for example. And then, the sad thing, dear participants, if the health workers are not able to address the current needs of the public because of changing needs, there will be entrepreneurs who will take over. These entrepreneurs may or may not be qualified to do the work. And so there will be task substitution or task shifting. Do we want that? That's something that's up for discussion. I'm just showing to you what are happening globally. In the next slide, I wanted to show to you that actually all these challenges have been existing even before the pandemic. What happened in 2020, 2021, 2022, and now 2023 is that COVID-19 was sort of like a magnifying lens. It just made things bigger and clearer. That indeed, these are our problems. Unfortunately, I don't have time to go to this one by one, but let me just quickly scan through this. No? Idea number one, no? Because of the disruption in health services, what have we realized? In the end, it's just us within the household, people from within the home. So that means to say, home and communities are central location where health should happen. Not really hospitals or clinics, right? So what am I trying to tell you? Nothing specifically, it's just that I'm saying that home and communities are natural places of health. How do we design our services? Are they too hospital-centric? Or are they also covering these new opportunities? Also, the concept of building trust and relationships, considering that there's an increasing use of technology, right? During COVID-19, I was still delivering classes also for some students at the university while I was in Port Moresby. The first time that I used Zoom, I was really, really detached because the students cannot turn on the camera. It's all black. Teachers like me, we like faces like this. If we see a black wall without photos or any person speaking, it's like talking to ourselves, right? So that is a very, very surreal experience. I'm sure you have stories to tell as well. And then don't forget, on the last point, which is very important, you are very privileged. Huh? Why you're very privileged? Because you, as health professionals or those that are related to health, have the privilege of knowing patients. These are sacred relationships, people exposing what they are, who they are, what is their medical history. You don't give those information for free. I won't tell you what is my medical history. I won't tell anyone just like that what medicines I take, but you know. What does that mean? People trust you. And if people trust you, what do you do with that trust? Next slide. I'm just going to remind the group that you are in the period of transformation. The Ministry of Health is committed to transform Indonesia's health system through the 6 pillars of transformation. And while we are already in this slide, I just wanted to point out that there is a huge section there, in fact, number 5, that is related to transformation of health workforce. Who is that? It's you, especially the future health workforce. No? And because of this, in the next slide, I would want to question this. No? The next slide would show to you what are our societal values. What are the roles that we need to fulfill so that we can contribute to this transformation process? How do you promote trust, access, equity, and accountability in health as health professionals? Maybe you might feel that this topic is quite heavy. I don't think so. because your role is heavy. Therefore, this topic should be fully embraced. Remember, when you already become nurses, when you already become, let's say, midwives, right? When people go to you, they give their lives on your. They basically ask you to hold their lives in your hands. So, if that's how intense the responsibility is, we have to take it very, very seriously. So the question is, what then is health leadership? Health leadership simply means you take an active role in the direction of the healthcare today. Right? In the Philippines, when I was still a full-time pharmacist in the country, what I noticed is that in my sector, in the pharmacy sector, most of the time, the voices of the youth are not heard. Okay? And then I always discuss with our senior pharmacists in the country, very respected professionals. I always tell them, I'm hoping that there will come a time when the young pharmacists will be able to be given the voice. Because while you discuss in the room and the young pharmacists are outside the room, the things that you're discussing inside the room is actually the future that I will be part of. Right? That's why in 2010, together with 2 colleagues, we established the Young Pharmacist Group of the Philippines. And a year after that, we have established the Asian Young Pharmacist Group with some colleagues from Indonesia as well. Why? Because we want to contribute to this agenda of health leadership. We have to speak. We have to talk about it. Why? Because that's your future. Do you want your future to be talked about without you? You just come in and, oh, this is my life. No. You have to partake, right? So the question now is more of a reflection for you. How do you want your future to be shaped like? And what are you willing to do so that you reach that point? The next slide, very quickly, I wanted to show to you that in relation to health leadership, we have to give premium on your individual self as a health professional. It starts all from professionalism. I'm sure nutritionists will have their code of professionalism. Our colleagues from the environmental health will have their own. Nurses and midwives will have their own. But I think the conduct of professionalism is quite universal, no? And what is the reason why we have this professionalism characteristics? Because we have a social contract with the people we serve, right? It's a commitment. It's an agreement between you and the people. It's like a covenant, a sacred vow. That's why you are not regular health, you're not just regular professionals. You are a very, very special cadre of health professionals, no? And then, once you acknowledge that social contract, then you realize that you are accountable. What does that mean? In pharmacy, this is very simple. When the patient takes the pills that we deliver to them, if they don't get better, or when they do not feel better after drinking the medicine, whose responsibility is that? Patient? Why are you removing yourself from the equation? So we say we are equally responsible. Accountability, right? And then, it does not just end in accountability at individual level. It is broader because now you have the concept of social accountability. Your action towards one patient will have impact on the bigger community. Professionalism, social contract, accountability, and social accountability. And then going towards the last part of my presentation, let's talk about professional culture and approach. No? The next slide would show to you what would it take for us to change the practice, for us to improve, for us to be competitive. No? For example, grow your career, not just here in Jogja. Maybe you want to try out elsewhere, no? Because you want new challenges and new opportunities. Remember that the health system is comprised of people, right? And what is the Health Workforce Challenge, dear participants? Who is the best group here? Nurses? Midwives? Who is the best group? Oh, very quiet, very diplomatic. I'm sure when you're inside your classrooms, you're all in agreement. Oh, nurses rock. Oh, midwives are better. Right? But, in reality, no one is better. All are best. You are all equal. Co-equal. That's the term. Because you are bringing in unique characteristics and expertise. That was my struggle when I was a young pharmacist in Philippines. It's so easy to not factor in what I have to bring in the table because number one, I'm young, and then number two, I am just a pharmacist. That's how some people would put it. But we keep on asserting because, competencies are there. Until one day we say we're confident to take our role. Pharmacy practice is my practice. And that's as important as any other practice. So what is the Health Workforce Challenge? You use your individual experience and expertise as part of the multidisciplinary team so that we will be able to reach our target outcomes. So, the next slide would show to you about professional culture. This is what I wanted to mention. No? Why are we going through education? Why are you still studying? Why do you want to study? Why do you want to complete? Or why is it important to study? I'm not promoting this because I'm a former faculty member. I'm saying that it is important because it's the base of what you can do in the future. Competence. No? So that in any occasion, in every occasion, if you speak about nursing competencies, you can do it. That talks about standardization and reproducibility. But it shouldn't stop there, right? Because in the next slide, I just wanted to show this to you, no? Because I know that our educators are also here, and I'm sure that they will agree with me. Education is a very, very important tool. It's an empowerment tool. I hope you appreciate the perspectives that I'm offering. You see, I'm an educator, I'm a health professional, but there's a lot of emphasis I put on the social constructs. Right? Education is an empowerment tool because we allow the individuals who are educated to discern what is good for them and for the people that they serve. And that is very important because it's linking back to the concept of health as a human right. Right? That's why when I was a student, pharmacy is heavy on memorization. I always ask myself, why do I memorize all of these scientific names? What good will it do to my to my patients in the future? Then I realize eventually they are important. There is a value to doing that. No? So I hope that you embrace the value of education as part of your development process. Now, very quickly, on the next slide, I wanted to show to you the tenets of professionalism. This is pharmacy specific, but as I said, these are quite universal. Maybe have some reflection. Ramadan season is a period of reflection too, so please add this in your reflection points. No? Do we have this? As we are students, are we working towards this? Are we near this? Or are we still very far from this? For example, the concept of altruism, doing good things without vested interest. Right? Really absolutely working for the good of our patients. No? I won't go to this one by one, but I think these principles are universal. So again, an encouragement to all of you to basically reflect on this. And then we go to the next slide, which talks about interprofessional education and collaboration. I asked, who is the best? Who is the better group? People were quiet, quite shy, but I know you have opinions, right? But in reality, as I've mentioned to all of you, no one is better than others because everyone is best, because we are co-equal. What we are emphasizing, and I hope maybe in Polteke's framework, no, the way subjects are taught, we can look into this. No? Many studies have shown And in fact, we have WHO standards for interprofessional education and collaboration. The outcomes in terms of competencies and the abilities of our students will be better if they are operating at a much earlier stage in their professional life or in educational training, working together with other members of the healthcare team. So the hierarchy disappears because now you're working as a team. So the next slide would show to you interprofessional education and collaboration. If they can move the next slide, please. Yes, this is what I was referring to earlier. So IPE will be promoting IPC, which of course will contribute to what we call collaborative practice in the next slide, which will bring you many of the advantages. The next slide would show improved access to health care, better chronic disease outcomes management, patient safety, etc. Finally, for change approach, the Astana Declaration factored this in. No? They said, how can we drive success in changing or improving the health landscape? These are what being offered. Improvement on knowledge and capacity building. That's why WHO is very keen in supporting Polteques. The use of technology, right? I'll just use my example as a pharmacy educator. Before, we need to have an actual pharmacy set up to teach counseling and dispensing. But now we have simulation of an actual pharmacy in a virtual space. And that's facilitating a lot of learning, quite cost-effective even. No? Financing is important. Somebody has to pay the bill, right? Whether it's you, me, or someone else, someone has to pay the bill. And don't forget, again, the star of our discussion today, the human resources for health. So if we put them all together in the next slide, the health system comprised of the building blocks, which include you. We do some changes in the way we do our professions, right? Individually and collectively. And then we take on the change approach that could prosper to practice improvement and practice change, which will be equivalent to practice advancement and what we call integrated people-centered health services, which on the last slide will tell you what exactly I mean by that. IPCHS simply means you put people first, communities first, not the disease, but the people at the center of the health system. Why? Because health is not just biologic in nature, right? It is determined by many social determinants, and at the end of the day, it is the person that you should be looking after. And then, it also relates to the slide that I showed to you earlier in terms of your scope of work, from the healthy people down to the people who are recovering from disease. Your scope of influence or scope of power. And then, let's not forget, IPCHS is also consciously adopting the perspectives of the individuals, families, and communities because you see them as participants as well as beneficiaries. So to end my presentation, I want to show this slide to all of you. What do we do for us to do health leadership? For you to become the best nurse, the best midwife, the best sanitarian, right? That you could be. Individual. Number one, personal effectiveness. Don't complain when you're going through education process if the teachers are giving you assignments. There's a reason for that. You don't expect to be the best without doing any assignment. It will be a miracle if that happens, right? How can you work on, let's say, a competency or a skill without practicing? That's why when I was a full-time faculty at the university, I told my students, practice in this campus so that you don't commit so much mistakes outside. This is the best place to do it. We are supervising, we're guiding you. So, don't complain too much. Go through it because just like the diamond, what does it say? Diamond is charcoal, right? Same, carbon. But because of too much pressure, the carbons rearrange so that they become diamond. What are you today? Charcoal or diamond in the making? Second, eventually when you become members of your professional societies, what we want is collective vision. Where do we want the Indonesian nurses to be? Where do we want the Indonesian midwives to be? Where do we want the sanitarians to be? Right? Where do we want to be as a group? Because when people perceive a health professional group, they don't think of individuals, they think of a group. So, if you are good, but most are not good, what is the perception? You are not good. Right? So, influence others to become good. And how do you do that? Through collegiality and professional groups. And then, don't forget, you cannot do the work on your own. You need to synergize with partners. Work with NGO, civil society, government, etc. And then, finally, society. Don't you want to say to yourself, after retiring from many years of work, I've made my part, I am a socially relevant professional. Right? So this all entails a lot, no? Like the ones that are seen on the blue box. Improve on your knowledge and skills. You have to train. You have to build your confidence. What I notice sometimes, Indonesians, they're very shy to share many good things. You're doing a lot of good things. You have to assert because you have what it takes. The best practice, many good practices are in the country, right? Represent well the country, represent well your profession because that's very important, because you have it. You are authorized to do it because you have the tools, you have the examples and experiences. And lastly, collaborate and partner with other individuals and document, because, you know, in management, what do they say? If you don't have documentation, it didn't happen, right? So if you're good, you have to document that so that people would know you really are good, right? So in the end, what I wanted to mention is, with this very short introduction, I wanted to just mention to all of you, the future is so bright for every one of us. Very, very bright. In fact, for someone of my age, I'm not very old, but I would tell you, I envy the young. Why? Because your opportunities are limitless. It's only really up to you what you want to happen and what you want to become. So my question, what do you want to be? Charcoal or diamond? Charcoal? Huh? Diamond. So, already I can see diamonds in this group. So imagine one day, all this room will glitter, and of all of you, of course, at some point, ma'am, they will come back, right? And give back to Polteques, right? When you're already successful, you have to pay it forward so that the others will also become diamonds in the future. So I think this is my time. I'm very worried of my extension, but I'm very glad that I have interacted with you. Terima kasih banyak.
Thank you. Applause once again for Mr. Eric. Okay, thanks you for nice presentation, and also I'm so sorry. Now we have to open, but only a question. Please raise your hand and stand up, and don't forget to mention your name and department, please. Okay. No question. Oh, yeah, okay. Please stand up and then make. It's very clear presentation. Yeah, please mention your name and your department.
Good afternoon, everyone. My name Nurul Latifah from Midwifery. Baik, pertanyaan saya, bagaimana cara agar masyarakat kembali mempercayai kita sebagai tenaga kesehatan? Karena belakangan ini kita melihat di sosial media banyak sekali hal-hal yang membuat tenaga kesehatan itu menjadi buruk, seperti itu. Jadi banyak sekali hal-hal yang membuat tenaga kesehatan itu seakan citranya menjadi buruk dan tidak kembali lagi dipercaya oleh masyarakat. Nah, bagaimana cara kita agar masyarakat kembali mempercayai kita sebagai tenaga kesehatan yang profesional? Seperti itu. Terima kasih.
Okay, thank you. The question is now health providers maybe have a negative label from social media. So how to make the strategy to make the community believe and then maybe proud to the health provider?
Thank you for the question. That's very important. Actually, the COVID-19 experience really magnified this. No? Not just groups of individuals, even institutions, no? Questioning, no? And putting them in a bad light, no? Which is not good, no? Especially if you are doing your job properly, right? I think social media is something that we have to really master, because there's so many things that we don't know yet. Its power and scope is so huge. Therefore, individual efforts will be good, but they will not be sufficient, right? And that's the reason why I was mentioning earlier that it's important that individually we are okay, but we are able to work with the people, like for example, our fellow, in my case, fellow pharmacists, fellow nurses, fellow doctors, fellow nutritionists, fellow environmental health scientists, no? So that we can come strong together. There are many mechanisms to do that. Like for example, during COVID-19, there was a pandemic, another pandemic apart from COVID-19, the infodemic. You know, it's like an avalanche of wrong information. That's the reason why we had to have platforms for counter information. But see, if there's no organized effort like that, if you have one small voice, it will be drowned by the many noise in social media. Sometimes social media, they don't have rules on engagement. They're so wild, right? Disrespectful. Sometimes people are not even real people anymore, right? Because you don't know who you're talking to. These are like dummy accounts maybe, no? So what I'm trying to suggest here is that, number one, at an individual level, no, it's important that you build that competency so that you're very sure what you are and who you are as a professional. The message there is be the best health professional you could be. That was my motto for myself. I have to be the best pharmacist that I could be. So that whatever it takes, whatever it happens, I can be confident in explaining myself, in relating myself, because I know my core. I've worked hard for it because I know it's not just for myself, it's for the people that I serve and work for. So that's one. Number two, we have to establish strong ties with the people we work with closely, our fellow health professionals, no? And this is something that can be facilitated by professional societies, for example, right? And then it goes through partnerships as well. Like in the Philippines, just to cite to you, we're working closely with patient groups, for example. So later on, it's not us defending ourselves. It's the patients defending us because they understand our role. And they are convinced because, as an individual, I know who I am and I'm demonstrating that excellence because I'm working hard for it. Again, people will believe and trust in you if you are personally effective. It all starts in competency, right? So if you say, oh, it's so difficult to become a nurse, embrace it. You have to be the best that you could be. So that wherever you are in the future, whether you'll practice here, outside Jogja or maybe outside Indonesia, you'll be confident to deliver what you're supposed to deliver because you know your core, your professionalism, and your ability. But then, again, it requires a systematic intervention. It's something that we cannot extinguish on our own. There has to be an organized way of managing it. I can only cite some examples that I know. In Philippines, as I've mentioned, we have groups to specifically work on increasing the professional image of the pharmacist. I'll use my examples, right? So we started with social advocacy work. We introduce who the pharmacists are to the people, what they do. Because sometimes the judgment is not because they want to judge you, it's because of their lack of understanding of what you are and who you are. So it's important for the health professional to explain what you are, who you are, what you do, and then demonstrate that you can do that excellently. And then they become your advocate. They'll be your promoter. Because what will happen is that they'll benefit from the services that you provide. So I will put it that way. But on a different day, when I have a longer time, I will discuss with you more. Thank you for that question.
Okay, thank you, Mbak Nurul. Thank you for Mr. Eric for your clear and very interesting material today. And thanks to all audience for the active participants. And we have to remember what Mr. Eric said, that we all is a agent of change. And then we can change the complexity to be opportunity, and we have to be diamond, not charcoal. Like, okay, thank you. I think it's enough. I'm sorry for the limited time, and thanks once again for all audience and Mr. Eric. See you next time. And terima kasih banyak. Sama-sama ya. Sama-sama. Yeah. Assalamualaikum warahmatullahi wabarakatuh.
We hope the material given this afternoon helped form a clearer understanding on how to become a strong leader in healthcare. Before we close today's agenda, we would like to invite Dr. Iswanto to come forward to sign the report of visitation with Professor Salenga. On behalf of Yogyakarta Health Polytechnic, thank you, Professor Salenga, for your time. Guests, please remember to fill in the attendance and evaluation form in order to receive a certificate. Thank you for your cooperation. I, Tiara Shifa Hernowo, would like to apologize for any mistakes I intentionally nor unintentionally made throughout my time guiding this lecture. Thank you for your participation and attendance. Wassalamualaikum warahmatullahi wabarakatuh.